14, final reading of Senate Bill 2866, Conference Draft 1, making an emergency appropriation to the Hawaii Health Systems Corporation.
Discussion. Senator Sloan.
Yes, Madam President. I rise in opposition to the bill.
Please proceed.
As I've argued previously, emergency appropriations for the Hospital Association is continuing to throw good money after bad. We continue to subsidize a failing operation. We spend more than $100 million a year. We have these special bailout emergency appropriations for, unspent or uncollected bills and for more collective bargaining to bail out Kauai. When is this going to end? We had a bill to transform the Hawaii Hospital Association. That bill did not pass this year. No changes have been made. As long as they know that they can come back to the legislature, the taxpayers, for more money, there is no incentive to change or improve or to live within their means. Thank you.
Further discussion. Senator Baker.
Thank you, Madam President. I rise in strong support of this measure.
Please proceed.
And take great exception to the mischaracterizations by the minority leader on the hospitals. It's not a hospital association. It's the Hawaii Health Systems Corporation. It was created by the legislature. It's primarily Neighbor Island hospitals. And I believe that Neighbor Island individuals, residents, deserve the same high quality care and access to services and treatments that folks on the larger populated island do. And I think it's unfortunate that the efforts that we've made in the past have met with inadequate funding. There are not economies of scale in the hospitals, and I think that's always going to be the case because the populations that they served are much smaller. There's a higher incidence of folks on Medicaid, Medicare, and uncompensated care. We cannot turn those folks away. We have an obligation. I too am sorry that the framework didn't pass, but I know that even absent that framework, which will be necessary if we're to transition to a new model and a new model of management for the hospitals, we will continue to work in the interim. I appreciate the effort that the health chair did in conference to try to move it along. I appreciate what the health chair on the House side did to try to move it along. There are some very thorny issues and some very difficult issues that we on the neighbor islands will continue to struggle with and ask for the support and assistance of our friends and colleagues here on Oahu. We cannot get away from the fact that hospital service is essential. If the hospitals on the neighbor islands go down, the hospitals on Oahu will not be able to pick up the slack. And I don't think anybody on this floor, Republican or Democrat, wants to deny people quality health care. I appreciate that we need to do some streamlining, that we need to make some changes in our structure. It is time. We took many years ago, back in the late 80s, the community hospitals in part of the Department of Health and move them to HHSC. We need to make that additional transition out of that model to another one. It will take everybody's care and effort, but we need to move this measure forward because we need to make sure that our hospitals are there providing services for all of our residents and visitors. Mahalo.
Further discussion. Senator Sloan.
Thank you, Madam President. Just a brief rebuttal. The issue here and the argument is not for care of people. There's no argument that we need to provide the best care. The argument really is not even Oahu versus neighbor islands. The issue and the argument is whether we will continue to subsidize and bail out a failing organization that fails to make changes. And in the past, when we've given extra money, that money was used for bonuses for the administrators and for the executives of the hospitals. This money now is primarily for labor unions and for bills that have not been paid. That really is the issue. And we've got to wise up and we've got to spend the taxpayers' money better. And if we want quality medical control, then what we have to do is look at some of the other expenditures we make and decide that this should be more of a priority. but we can't continue the level of subsidy year after year after year and saying now is the time for change, and we've had no change in 15 years. Thank you.
Further discussion. Senator Baker.
Madam President, with the indulgence of my colleagues, I cannot let some of the previous speakers' statements stand. Hospitals, by their very nature, are labor intensive. That's really what you're paying for. You're paying for doctors, nurses, technicians, as well as the appropriate equipment to make those diagnoses. Yes, I do agree that we need to make some changes in the structure, but you cannot let the services fall. You cannot afford not to pay vendors so that you have the equipment and the supplies and all of the things that it takes to run a hospital. Medical costs in this state are rising higher and higher. We are allowing people to go to emergency rooms, the most expensive care, rather than going to their primary care or to a clinic during regular hours. That's just the nature of health care. And as long as there's no way to curb the cost of rising health care, whether it's through salaries or vendors or other services that the hospital has to provide, I think it's incumbent upon us to continue to work with our Hawaii Health Systems Corporation to find the ways that they can streamline, find the ways that they can improve their services, perhaps at a lesser cost, but understanding that a lot of these costs are costs that they have no control over. They don't bargain for their employees. It's bargained by others, the governor being the chief bargainer, and when an agreement is reached, the Health Systems Corporation is obliged to pay for those services. I don't think that we want to balance a budget or balance the expenses of the hospital on the backs of the nurses, the techs, and the docs that have to provide the services. And our citizens deserve nothing less than the very best that we can provide them. Thank you.
Further discussion. Senator Kouchi.
I rise in support, Madam President.
Please proceed.
On April 14th, they had a meeting at Kauai Veterans Memorial Hospital in West Kauai. And the administrator told all of the employees, that included doctors, nurses, janitors, cafeteria staff, that changes needed to be made because they had insufficient funds. They had promised to fill all of the beds when they came back in October during the special session to be more economically viable. And in spite of filling all of those beds, they were still falling short of the budget. On Good Friday, when I was back home, I walked into the hospital knowing that somebody would be on duty and just started talking to employees. One of the doctors that I spoke to that day is an emergency room doctor and said that his group came forward to the CEO and said they would take a pay cut to try and help some of the goals that they're meeting. So I can't speak for other hospitals, but I can certainly say that the $15 million here, when Kauai applies the formula to what they'll actually get, is still not sufficient for their needs. And so those changes that are being talked about are in fact being implemented and being sought on Kauai. Otherwise, they will still not be able to keep their doors open. And so I think I'd be remiss if I didn't stand up and speak on behalf of the hospitals in my district and express the changes that they're going through, what they're hoping to try to restructure and accomplish so that they can continue to deliver medical services in our rural community. Thank you.
Further discussion. Senator Green.
Thank you, Madam President. Just for a little perspective in support, yes, I do think it's important for us to pass something similar to our legislation that we discussed this year, which was the Senate Bill 3064, and that, you know, it's going to take compromise and partnering to get that done. But for perspective, we're talking about a $15 million emergency appropriation. This year we'll spend $9 billion on health care in the state of Hawaii. That's the all-in, $9 billion. So we're all pretty savvy here about money. $15 million to keep these hospitals, you know, afloat is important, and it's $9 billion that's spent statewide, number one. Number two, though there are concerns about costs, and we should run a good system, a tight ship and so on, just also I want to reiterate the points that were made about the way the structures of hospitals are. 70% of those who go to our safety net hospitals have Medicare or Medicaid. Those are really, really low reimbursements from the state and the federal government for services rendered to keep our relatives alive. So that is the main reason that it's very difficult to provide for enough money to be in the black for these hospitals. We will continue to work on reforming the system. I take to heart those comments. I thought we were there this year. The last little wrinkles can get taken care of, and I hope that next session we'll be able to pass that legislation. But please keep these things in perspective. Thank you, Madam President.
Further discussion, members? If not, do we have unanimous consent? No votes from Senator Sloan, all others voting aye.
24 ayes, 1 no.
Senate Bill 2866, Conference Draft 1 passes. Final reading.
Conference Committee Report Number 107-14, final reading of Senate Bill 2073, Conference Draft 1, making appropriations for collective bargaining cost items.
Discussion. Senator Sloan.
Thank you, Madam President. I'll be voting no on this bill and the following bill. Both of them are collective bargaining items. Both of them saw increases from the original amounts and original estimates. This particular bill will add $15.5 million over the next 2 fiscal periods. The next bill will add $27.3 million over the next 2 fiscal periods. Again, when we're looking at everything in total, we have to prioritize what our expenditures are for, and we have to get our costs in order. These bills do not do that. Thank you.